Hi, so I just wanted to give a couple tips about laparoscopic surgery. I had surgery um, last week. It's been 7 days yesterday, and I learned about a supplement that I want to share with you that can help you with the recovery. I wish I would have known about it before because it definitely helped me a significant amount, and I only learned about it after. Unfortunately, our physicians, most of them are not inclined to tell us about a lot of holistic or natural supplements um, that can help us most of the time. You're not going to find that. So I did not, and I ended up learning about it after the fact. So the suffering that I had suffered, which could have been less if I had known about the supplement, is they inject in a port the carbon dioxide gas to spread out all of your organs so that they could work more clearly. And I wish I was even warned about that because I probably on my own would have researched, is there something that I could take to help with that? Or, if they said this is what we give you and it could cause pain afterwards, and even if they didn't suggest anything because it's against, their practices to suggest anything, if they just told me about the experience of this is what we do to you, which I had thought I got all that information from the telemed call that I had received. Actually, I had an appointment. This was postponed during the pandemic. So I was scheduled in April originally. Then I was scheduled June 10th. And then I was rescheduled June 17th. So I had multiple conversations with my physician and then a telemed um, appointment last week before it. And I asked, like, what happens during the surgery? What do you do? And I heard nothing about the gas at all, or else I definitely would have researched. If she had said, we do insert the gas and, you could cause some pain afterwards. So just, expect that. Cause I said, what should I expect as far as recovery and getting childcare? And, what's a normal pain, So if she had said, the gas does, sometimes it causes pain, sometimes it doesn't, even that, I probably would have researched knowing me and was like, okay, I want to try to alleviate some of this pain, and is there anything I could take? Because I typically do try to beef up on some natural holistic, um, items that can help prevent having more of a difficult time. So I did find out about it after the fact, but when it's trapped, the gas, it causes severe pain afterwards. And for some people, it is worse than others. For some, they can actually push it out for the most part before they close you and you're done. And then, as although they try, for some people, it's still trapped. So it ended up, I had an abundant amount trapped behind my ribs and it felt like my ribs were broken. I couldn't take a deep breath in, so they had to put me on oxygen. And then when I stood, my back just felt like it was in so much pain that I just was crying, and I was trying to move around, and I'm very, very good with pain. I have a pretty good high tolerance for pain. I've had, I'm pretty athletic. I've been training on and off. I've had, during trainings, like, scrapes, bruises, broken bones, fell. I do a lot of the Tough Mudder, like 5K races and the Tough Mudder 12-mile race and stuff. And there's a lot of, injuries I sustained, and I'm pretty good with pain. And this was pretty bad. I've also had a couple surgeries, and I was pretty resilient in recovery and had less than the average recovery. So for me, this was pretty drastic. I did talk to my doctor about having colitis. I was diagnosed 30 years ago with colitis, and I had suffered for some amount of years before I researched nutrition, holistic routes, natural supplements, and a specific, label research that I did with food and ingredients to study food to the point of giving myself the correct regimen, weaning things in, weaning things out, elimination diet here, adding things in gradually there. And I did work my way into remission, and I healed through the Crohn's, and that's extremely rare. And I sustained the colitis for the most part. And I talked to my doctor about having a flare, recently, which includes a lot of inflammation, gas or inflammation. In my case, I was inflamed beforehand. So I know this played a major role in it, and that's a side note. But the main thing I want to talk about is the supplement. So activated charcoal, is something that I learned about after the surgery, and I don't know if it was a coincidence that right when I started taking it, I felt much more relief, and I felt better, and I was like able to get around more comfortably. Um, I don't know how much of a coincidence it is, but I'm gonna say this has either 90% to 70% responsibility for the relief that I felt. And I did not learn about this until Saturday. So I had the surgery last Wednesday. I learned about this Saturday. So needless to say, Wednesday I spent like triple the amount of time I thought I would in recovery. And I was knocked on my, you know what, for a good like 2 days after that. I started feeling a little bit better on Friday. And then all of a sudden on Saturday, I felt like worse than I did on Friday. And I felt more soreness and pain in different areas. And I just still felt my ribs were still like broken. I felt like they were severely broke on Wednesday. And then they were like, um, like still, damaged and broke on over the weekend. So long story short, try this active charcoal beforehand. You can actually try it. I don't know how many days, but I would do like 2 days. If you don't have like any digestion issues at all, or any like gut autoimmune diseases like I do, I would try this at least 2 days before, and then you'll deplete yourself from the gas that you have in there. At least you'll know that, because it's 2 tablets in the morning and 2 at night. So even if you did it one day before, I'm sure it will do something if you have no problems with gas or bloat or any digestive issues. But I would say that definitely 2 days getting it into your system will take effect beforehand. It will start taking effect a day before, but obviously it'll be in your system a little bit more, so it'll start taking effect a little bit more if you take it 2 days before. Once you start taking that, obviously through recovery, you'll probably be in much better shape for recovery and afterwards. Hope this helps.